Good afternoon, everyone, and welcome to Baswell England's LGBT History Month event, Improving LGBTQI+ Young People's Experiences of Social Care. My name's Rebecca Pierre. I'm a professional officer for Baswell, and I'm also care experienced and with experience of children's social care myself, so really delighted to be hosting this event. Today we'll be joined by members of the team from behind the LYPSA project to hear about their research and how we can improve outcomes for LGBTQ+ youth in care. Before I introduce today's speakers, I have to get the boring housekeeping stuff out of the way. So firstly, we've disabled the chat for this session along mics and cameras, but you are able to submit comments and questions to the speakers through the MS Teams form that was emailed to you with the link, or by scanning the QR code on the screen now. It amazes me how technologically advanced Baswell has become in the short time that I've worked here. This session will be recorded and shared on the Baswell YouTube channel, and we will also send out slides to everyone after the session. If you'd like to share on social media, you can tag @Baswell_UK. So I'm thrilled to introduce today's speakers. We're joined by research lead for the project, Dr. Jacob Schaub. Please correct me if I've mispronounced your name as well, who is an associate professor in social work and director of PGR for the School of Social Policy at the University of Birmingham. Member of the research team, Dr. Willem Stander, a postdoctoral research fellow at the University of Birmingham, who specialises in research on the health and well-being of LGBTQ+ and youth populations, as well as enhancing professionals' practice with these groups. And lastly, project advisor Omar Mohammed, who is a newly qualified social worker and expert by experience. Thank you all for coming along to speak with Baswell today, and I'll hand over to yourselves.
That's great. Thanks, Rebecca, and thanks to Baswell for inviting us to present something for LGBT History Month. For those of us that work in this sort of activism and research space, the February is quite busy for us, so we're really delighted that we've been able to come and speak to a range of social workers across the space that we are looking at. I'm just going to do a short introduction of the three of us on the research project, and then we'll get into talking about the project and what the findings were. So my name is Jason Schaub. I'm one of the academics at the University of Birmingham, and I led the project that was funded by the What Works Centre for Children's Social Care, which has now become Foundations. And I'm going to hand over to Willem, and then Omar's next.
Hi everyone, it's lovely seeing all of your faces. My name is Willem Stander, my pronouns are he, him. I was the research fellow on the project, and my research interests are primarily around the health and well-being of LGBTQ young people, specifically their mental health and their help-seeking behaviours. And I'll hand over to Omar.
Hi everyone, so my name is Omar Mohammed, my pronouns are he, him. So I come at this as I think Rebecca said, a project advisor, kind of a young advisor, so as a young person who's part of the LGBT+ community, as well as all the other roles. So as a social worker as well, as a person with lived experience of social work services throughout my childhood, etc.
That's great. Thank you for that. Just to point out that the slides will be coming up in just a second, and we can talk through the project. And the work that I've done over the last few years has repeatedly looked at the way that LGBT people engage with and experience social care. And I'm particularly focused on the way that professionals support LGBT people. And this study looked at LGBT young people and their experiences in social care, focusing predominantly on their experiences of residential social care, and I'll explain some of the reasons why. So like I said, we were really delighted to get some funding from the What Works Centre for Children's Social Care, and it was situated at the University of Birmingham. Even though it was a national size study, we were talking to people all over England. Okay, next slide, please. So the thing to point out in relation to this, to identify the sort of scoping review and the idea about this, is that when we look at the experience of LGBT young people in social care, it doesn't get as much attention as other minority groups. Now, that doesn't mean that we think that other minority groups don't need a lot more attention. We would argue that they do. But in comparison to those groups, LGBT young people get less space and time in both practice, research, and policy. And that means, and it's contributing to a sort of a blank spot, if you will, in social care sort of knowledge and social care practice. And the great thing as a researcher is it means that pretty much any question I want to be asking hasn't been asked before, and so I'm able to ask it in a research context. One of the challenges about that is that we draw a lot of our knowledge from outside of the UK, and that has complications about applying to our policy as well as our cultural standards. The objective that we had in this study was to improve LGBT young people's social care experiences by hopefully improving LGBT, the knowledge and the engagement of social care workers. It was both collaborative and co-produced with LGBT young advisors with lived experience as well as stakeholders. What that means is that we had a group of young advisors that contributed to the study on an ongoing basis. So when we talked about interview questions, they looked at the interview questions and said to me, Jason, you're an old white man. That's not how we would say those things. That's not going to encourage participation from young people. Fair enough. I'm completely out of my wheelhouse in relation to that. So I'm very happy to be schooled by people that are closer in age and experience than I am. They also helped us when it came to the data analysis, so that the things that we think we were looking at were supported by what they understood as well as their experiences across their sort of networks. And they were really useful for us in shaping those things, particularly the model, and we'll talk about those, as well as the recommendations, because we made some pretty strong recommendations back. And actually, we were strongly encouraged to be strong about those recommendations from the LGBT young people that we were working with. This project falls into three phases. So there was an international scoping review, which just meant, and I described my job like this repeatedly, I'm an academic, so that means I have the time to go away and read all the papers that you as busy practitioners don't have time to do. And then I compile those and point you to what is the best evidence and also what those pieces of evidence say. So that's one of the jobs that I have as an academic. And that means the international scope review, we looked at the best knowledge that was out there about LGBT young peoples and their social care experiences. We then did an interview study of LGBT young people's experiences of residential social care. We were building on some work that Janet Kosar and her colleagues had done at the University of East Anglia around the experiences of LGBT young people in foster care. But nobody up until the point of this study that we'd done had spoken to LGBT young people in their experiences of residential social care from a research perspective. We're aware that practitioners speak to them all the time. We were looking at this from a research perspective, being able to draw out findings and situate it in a wider sense of knowledge. And then the third study that we did was we tested an online training package to see whether that training package actually improved the LGBT knowledge of social workers and decreased their discriminatory attitudes. And we were very pleased that it was successful on both of those circumstances. And if you know anything about research at all, when you try to do an experiment like that, it's very rare that you recruit enough people to do it. And the second, that you don't generally find that it actually works. So we were very pleased on all of those things. So I'll try not to geek out too much when we get to that, but it's a slightly interesting element of what we tried to do. Okay, next slide, please. So if we look at the international scoping review findings, the information that's key about this is that the research knowledge is relatively scarce, like I said, and it's a variable quality. So that means that a lot of it isn't drawn from a wide enough base that it can prove some of the things that is being said about it. And that's a challenge when we're looking at trying to design services. And the other complication about it is that a lot of it, or the bulk of it, is from the United States and some secondary amounts of it from Canada. And there are complications about applying that to the UK, both culturally as well as from a policy context, which people will be aware of. What we do know is that LGBT young people are more likely to end up in care, and they're more likely to end up in residential care, particularly, than their peers. And there's a variety of reasons for that, but the central sort of core running thread in a range of studies is about the fact that LGBT young people experience family and carer rejection based upon their identity, which also means that they're less likely to be able to draw on that first round of family that's just around their core family, and then their wider community and family network. It's not consistent across all LGBT young people. I'm not saying that these circumstances are ubiquitous, but it is something that we need to be aware of that's different than it is for other groups of young people. And that means that our first sources of support that we draw on in social work is problematic in this space. And I say that as a former children's social care social worker and manager. When I supported young people in care, one of the first places we would talk to would be the wider family. And that's more complicated in this circumstance. This group of young people, and those of you who work for local authority children's social care, your ears should potentially prick up at this point, experience more placement moves, and they have a longer duration in care. And for your central government returns, those items are challenging. And that's in comparison to their other peers that are in care. And that's important when we think about the experience of those young people and why those circumstances might happen. Now, I can't say, because we've not done a study about the decisions to make placement moves and other things like that. But if we look at this as in the round, they're more likely to end up in care. They're more likely to have more placement moves. They're more likely to be residential care. They're spend longer in care. There's an element of a sort of an ongoing set of intersecting challenges that they experience, which might lend itself to be thinking about discrimination. We think about their later experiences and their experiences outside of social care. They have heightened educational challenges, so their experience at schools is just not as good generally. They experience more bullying, they have more challenges with teachers and a range of sort of circumstances. They also have poor health outcomes, most particularly physical health, mental health, and well-being sort of factors. Okay, next slide, please. So there are three groups amongst this population that have greater challenges, and that's when we think of intersectional identities and how those affect this group of young people. So racial and ethnic minoritized young people that are LGBTQ+ have greater challenges. Now, I'm not expecting that this is going to be a surprise, and if my father was on this webinar, he would be saying to me, Jason, that is not rocket science. You're absolutely right, that is not rocket science, but it's important to point out that that has been shown across a number of studies. The same thing is true for lesbian and bisexual girls and young women, as well as trans and non-binary young people. So what that means is that there's a series of intersecting identities in addition to being LGBTQ+ that cause additional barriers and challenges that compound their experiences. When LGBT young people have been spoken to about their care experiences, so this is all still outside of our study, they were more dissatisfied with their care experiences. So when you're asked, did they experience good support, they would say no. These things combine to show why LGBT young people are at greater risk of homelessness. That idea about not being able to draw on your wider family means that those first, second, and third ports of call, which both the family as well as social care would be using, are often not available for LGBTQ+ young people. And it's important to think about that in relation to the particular challenges for this group of young people, why they might end up being at risk of homelessness, and then also what the implications of that are, because they have greater exploitation challenges after leaving care, and they use what are called survival sex more often than their peers for food and shelter. So these are, I hope what you're getting is a sense of the sort of significant challenges that this group of young people experience that are above and beyond what the rest of the population that are already experiencing challenges. I'm not suggesting that their experience is utopia or Elysium fields or anything else like that. The 2 points at the very bottom of this that I want to point out that are of particular interest, I think, here for BASWA, as well as when I discussed this with Social Work England, is that social workers and their carers and the carers, so foster carers, reports a lack of adequate knowledge in relation to this and training, and also some discriminatory attitudes. So when we test this across a variety of studies, and we've seen this, that they're both asking for more knowledge and that they're anxious, that they want more training, and that there is some evidence of discriminatory attitudes. There are also few specific policies that are specifically related to LGBTQ+ young people. And that's important when we talk about supporting and protecting them from what is called sexual orientation and gender identity and expression discrimination. And that's that acronym that we've got there, which we use throughout this presentation, as opposed to writing out those terms repeatedly. What that means is, both from a national policy perspective as well as from a local authority perspective, we would be suggesting that there would be a more targeted approach, because this particular group within a vulnerable population has additional needs that are not being met. Okay, next slide. So I'm going to just talk briefly about this before I hand over to Willem to talk about some of the findings from the residential social care experiences. But in general, this is some of the information that we pulled out from the study. So we spoke to 20 LGBT young people, and their age ranged between 16 to 24. It was the first time, like I said, that anybody in the UK had spoken to young people in residential care that were LGBTQ plus about their experiences. So we've done practice evaluations, other people have done practice evaluations and things, but nobody had ever undertaken a research project. And what that means is we can point to this as a study where we can then see whether there's been changes over time and what some of the issues that are underlying this. There was some widespread evidence that the young people told us of experiencing discrimination, particularly around policing of their gender norms. And they experienced that from peers, staff, from the placement, as well as from social workers and their birth family. So they talked about this as a sort of a web around them, that they were experiencing challenges on a number of people. They talked about a huge number of disruptions. And again, I want to point to my experience of having worked in London local authorities as a children's social worker. So I thought that I had a relatively good sense of what was expected and typical, and I was surprised at the level of disruption that they talked about. They also talked about coping with unmet needs around mental health, and particularly sexual health and sexual support needs. They often attempted to hide their LGBT status in new placements. And what the challenge is that reduces their connections to support and increases their isolation. We can talk about some of the reasons for that, but generally they said they were worried about coming out because they were worried about discrimination from staff and from their peers. What I do want to mention here is that they talked repeatedly, though, about the fact that affirming relationship with care professionals, even if it was only one person across their care experience, was really important to their confidence and their well-being, but that those relationships are often the unusual set of circumstances for them as opposed to the norm, but that those relationships, they often returned back to those people, even informally, and that they would inform other young people about that social worker who was helpful to them, so that other young people would search them out. So there is an element here about the fact that we can do something to help these young people's experiences. I do just want to point out that we've created an animated video about the findings and what the things are that you can see. And there's a YouTube clip there, as well as that QR code that you can use. And you can use that in training videos. It's freely available. There's no firewalls or paywalls on anything that we're producing for this study. So you want to use that as much as you'd like. And we produced that, like I said, in collaboration with our young advisors, and they contributed to particularly the text. Okay, next slide, and I think I'm handing over to Willem.
Thank you so much, Jason. I should just jump in there to say that if any of the QR codes don't work for you, we do have the website or the project website address at the very end of the slide. So I'll share that with you in just a little bit, but they should work. I did try and test them. I'm just not entirely sure how tech savvy I am sometimes in creating these. As Jason was saying, we just discussed some of the findings from that residential care study, and this is just a quick overview for you of the participant demographics who were taking part in that study. So we were very pleased to have a very diverse sample, as you can see there from the graph there. We had a substantial range of ethnic minorities taking part in this study. We also had a broad range of sexual and gender identities as part of this. So if you look at some of those percentages, 35% of the sample was bisexual young people, followed by lesbian girls and gay boys and men. Gender identity, it was primarily trans and non-binary young people who took part in this, so 35%, followed by cisgender males. And in terms of ethnicity, half of the population was white British, followed by other groups there as well. And you can see a breakdown of the age range, and then also just the varying locations across England that took part in this study. I should apologize if it's really loud in the background, but I am in Brighton and it's a very busy street downstairs. So if you do hear hooting, I apologize for that. Moving on to the next slide. So just to be mindful of that, the following quotes are just examples from the data set. They're not the actual themes, but it should give you a good indication of some of the things we found. And you can also see these in the qualitative report and journal articles. So that first quote we have there for you is about placement and academic disruption that the young people we spoke to experienced. This was quite common across the sample. As you can see there, when I was doing emergency placements, I would go to a place for the night. Then my social worker or one of their colleagues would pick me up in the morning. And then I would spend a day at the social worker's office, and they try and get me a bed by 8 p.m. that night. That went on for 6 weeks every single night. Apart from some weekends, I got to be there for a couple of days, but literally every day, a different care home or foster home, I was going from one side of the county to the other every day. I spent extreme amounts of time out of school. They also talked quite a lot about the experiences of multiple placements, as Jason mentioned earlier, and also about placement disruption, often because of discrimination around their LGBTQ plus identities, which had a profound impact on their health and well-being, and also their access to services. So in this quote, I'm on the gender identity clinic waiting list. I need to fill in my paperwork and send it to them with my address, but I don't know where I'm going to be living. So I can't do that until I know where I'm going to be living. It's the same with adult mental health services. It is the one problem that stems into everything else. And we have one more quote for you. We did find, I have to say, some really great, excellent, affirming examples of care professionals supporting young people in our study, especially trans and non-binary young people. So some examples, we're going to share that with you later as part of the good practice examples. But just very briefly, respectfully referring to their pronouns and their correct or chosen names, assisting them to get their gender legally changed, interacting with healthcare professionals on their behalf. So some really, really excellent examples. However, more often than not, we found some quite harmful and oftentimes very malicious misgendering and poor knowledge of trans and non-binary identities among some professionals. As you can see from the following quote, there was this new staff member who would often misgender me to other staff members. If there were residents around when he was doing that, he would be placing me in a dangerous situation. I wrote a complaint about it, but it was never seen through. I spoke to the manager, but she basically just said that I was being difficult. So you have an example there of the harmful misgendering and also just the minimization of the young person's concerns and their emotional distress in this specific case being minimized. Jason, I'll hand over to you for the model that we have here.
That's great, thanks. So what we did looking at the interview data is we compiled what we think of as a model about their engagement, LGBT young people's experiences and engagement across residential social care. And so if we start sort of in a clockwise motion, starting on the top left with the pathways into care. And what we did is we pulled out the barriers and the supports, the things that made particular difference to these young people. So they talked about sexual orientation and gender identity related abuse and rejection from their family and community. They talked about poverty, familial mental health, and substance abuse issues. Now, we're aware of the fact that some of these factors relate to lots of young people and not just LGBT young people, but they pointed at these as particular importance around their sort of entry into the care system. When we look at the social care sector factors, their experiences in care and being in residential care, and they also talked briefly about their experiences in foster care, but we didn't delve too much into those, is it falls into these 5 sort of groupings, these 5 factors: placements, relationships, outness, health and education, and resilience. And what we did was we divided those into affirming and non-affirming, or sort of challenging experiences that they described. So what you can see over here on the far right is the affirming versions of those. So that would be an inclusive environment in the placement. So that would be things, young people told us things like staff having rainbow lanyards or having a poster up that said something around LGBT people. This month is LGBT History Month, that's why we're here. And they would say seeing indications about that during LGBT History Month in February or Pride Month would be really useful for them. So the idea that there is an experience around that, including things like asking people what their pronouns are and how they'd like to be spoken to. Looking at relationships, they talk about supportive professional relationships, and as opposed to the non-affirming, which would be discriminatory relationships. And they would describe feeling very conscious of who was somebody that they could be supported by and who was somebody that they couldn't be supported by in relation to this. Now, the outness of this is slightly more complicated because some of this is predicated upon the LGBT young person's willingness and desire to be out to but whether it's the staff or the peers that they're alongside. And we're talking about positive social sexual orientation, gender identity disclosure, or indeed the concealment of this. And what we talk about in relation to that is their willingness to be out. And we're not suggesting that all young people need to be out to everybody that they connect with. But again, if there is something that we as professionals should be thinking about and concerned about, if LGBT young people are in residential care and feel unwilling because of concerns of discrimination to tell the staff that they're being placed with and that they're working with around their identity. And they also talked about that in relation to social workers specifically. These combine to talk about concealment and the implications that it has for accessing and support for health and education. And that includes issues like tailored environments as compared to generic support services. So the issue here is that depending upon a young person's outness and their supportive relationships and the inclusive environment of the placement, these things combine to have an influence on their engagement and the supportive nature of health and education. And those all relate to the way that young people were able to point to and identify their examples of a resilience. So those young people that had more of those other elements had a greater amount of resilience to draw on than young people who had more non-affirming experiences. And these all influence and affect the way that young people's transition into whether it's care leaving services or independence or connect later on to adult social care. Now, I want to point out that there are intersectional issues that ran across all of these things that would include issues of racism, sexism, ableism, and classism, and that young people were able to identify both the complicated sort of interplay of some of those intersectional identities. We've talked about this in a range of sort of publications and other things, including a practice briefing. So you might find it useful as something to be thinking about how, as professionals, you should be thinking and engaging with the experience of LGBT young people in social care. Okay, next slide, please. So I just want to roll over to Omar so he can talk about his involvement as well as some of the other young advisors on the research project before we pick up about some of the rest of the presentation. Omar, over to you.
Thank you, Jason and Willem. Before I go into my slide, I just want to take stock and just think, you know, no matter how many times I hear all of this data and all this amazing research, it just hits home, doesn't it? I think from a lived experience perspective, but also as a children's social worker, there were just so many, I think, golden nuggets, so many key learning points, and I know there's more. But yeah, I've come to kind of break up the PowerPoint a little bit to talk for a few minutes about what it was like to be a young advisor on this research project, and just thinking about, yeah, the impact that we were able to have. So I was one of 4 young advisors, and it was really good that we were able to have a group which was diverse in terms of our gender and sexual identities, as well as a lot of other protected characteristics. And what was really great is, you know, you've got this thing about advice, and actually you can choose to take advice. You can be given it, but then then it becomes a choice. But actually, what we were able to do is we were empowered, really, to be a critical friend. And we were really empowered to, you know, be part of every discussion there was throughout this entire research project. And it wasn't just we would give advice and, you know, it'd be considered and, you know, we didn't really hear back from it. You know, we were very much involved in the whole process. We were able to be critical. We were able to, you know, kind of give that criticism, but being really constructive with that, and be involved in those conversations throughout the project. So I think, as Jason briefly mentioned, for the first 2 studies, which obviously Jason and Willem have talked about so far, we were able to be part of that analysis to really help the researchers understand the information that was in front of them. Some of those early kind of themes that were coming through, we were able to advise on actually how does that link with that and those sorts of things. And actually, even before going to interview LGBTQ plus care experience young people, it was really important that those interview questions were really carefully considered and well thought out, and that they were meaningful, respectful, and supportive. So those were all really important factors within the first 2 studies. And I know Jason and Willem will go through study 3 and just kind of explain that in a lot more detail. But we were involved in the recruitment, you know, kind of making sure that That was advertised, being part of creating an animation to kind of explain what was happening for LGBTQ plus care experience young people throughout the study, being part of the analysis again of some of the information that was coming through study 3, and then also thinking about a journal article about the involvement of including young advisors on a research project. And I think the one of the biggest reflections is just how transformative, and often kind of we think of it as a radical thing to start to include advisors in a research study, but actually it just made so much sense. It didn't feel very radical. It just felt that it was what was needed. And I think every research project moving forward should be taking this very much co-production stance. And even within practice, as social workers in practice, we can absolutely engage with the people that we're working with. We can absolutely continue to hold on to co-production because it was really transformative. It meant a lot to be able to impact what was happening, to be part of lots of different people sharing their voices, which is really important. And now, we have a really, really great evidence base to use moving forward, which I'm sure Jason and Willem will continue to take us through.
That's great. Thanks, Omar. And this comes from the idea about no research about us without us. So the underpinning here is about making sure that we engage with the people who have a lived experience that relates to that. And in order to, like I said, keep my feet on the ground, which was very useful. They were very good about being critical friend and challenging and saying that doesn't seem suitable in this context. So in the last part of this presentation, I'm just going to talk briefly here about the third study that we undertook, which was a trial that tested an e-learning module. And it was the first trial of its sort in the UK. And we tested an LGBT youth e-learning training package. So it was e-learning. And the reason that we used e-learning, even though we know that in-person training is has a greater amount of impact and a whole range of other things, is we wanted to be thinking about something that everybody who works in social care or in social work could engage with. So that was our point, is that, yes, we would think that in-person training would be more useful, and also the context is really important, but we wanted to be thinking about how we get to as many people across social work and social care as possible. We used a pre-existing, already widely accessible e-module that was CPD accredited, and it took about 2 hours to complete, to give you a sense of what this is like. We had 614 people that were working in children's social care, that were social workers that participated. And for any of you that have done a study before, having that many people that took part in a study of this size was astounding. We were very, very pleased at getting that many participants that took part. They were divided into 2 groups. So one group received the training, and then another group didn't receive the training, but had what we call business as usual. And what that means is that if their local authority put on an EDI training package where there might be some information about LGBT young people, that would be allowable because it's not in relation to this. And that would be an ongoing circumstance that we would see. We then did what are called a pre and a post test. That just means that we gave somebody the survey before they took the training and after they took the training. What we were trying to see was whether there was any difference between the people that had received the training and the people that hadn't. And we were looking at 2 different main sort of areas: LGBT related knowledge and what their attitudes towards LGBT plus people. And there's a specific scale that we used in relation to both of those, and those have been used in other studies that we drew on and that have been applied here in this context, as well as with a range of other professionals. Okay, next slide. So this is what the study looked like and the way that it sort of carried out. There's a screenshot there of the training, so you can see what it looks like, and this would be sort of experience. What was important about this is that those tiles that you see on the bottom would flip. And so it was an interactive sense of engaging with these. And that meant that there were case studies that were there that we then, that the training package then asked people to think about in relation to it. What you can see on the left-hand side was the flow chart about the way that people were divided into these groups and what it looked like, and how many completed both the pre-test and the post-test, and how it was analyzed, and a whole range of other things. You can see that we had 1,500 people that we assessed for eligibility. So again, that's a huge number of people that were even sort of signing up and suggesting that they would be able to take part. But there were a number of people that didn't respond or were spam signups. Every time we do studies like this, I attract lots of bots from all over the world, which is great for my ego, but also doesn't do very much for research. So they all need to be screened out before we can carry on with the rest of the study. And that there were some people who didn't meet the inclusion criteria. Either they were outside of England, or they didn't hold a social work qualification, or for a range of other factors. Okay, next slide, please. So this is just a slide to show you about the effect of social media. And what you can see here is the challenges. So when I talk about undertaking research, one of the big things I say is about how challenging it is to get busy professionals to take part in these studies. And you can see how slow things were until about October. And then there's a massive jump up there, which for some of us we experienced also in our mortgage interest rate increases, not at exactly the same time, but not far shy. And this was when we started a social media campaign where we were advised by a social media consultant. And so that tells me that I am still not a Kardashian and don't understand how to become an influencer, but this does help us understand. And what's important about this in relation to what this means is that without the engagement of as many social workers as we had, we wouldn't be able to make some of the claims that we are able to do based upon that number of people, because we have to have a certain sort of sample number of people that are taking part before we can claim anything from it. Okay, next slide, please. So some of the results that come out of this. So the e-learning module was effective in two elements. So it both decreased people's heteronormative attitudes, so it made them more positive towards LGBT people. And the second thing that it did was it increased their knowledge. So it actually did what we wanted it to do. Now, again, thinking back to my father, if he was on this webinar, he would say, Jason, that's not rocket science. If you give people a training package, you would assume that it's going to do those things. That is what we assume, but there's very few training packages that have been tested like this. So actually, we use things that we don't know whether it increases people's knowledge, and we certainly don't know whether it actually decreases people's attitude, their discriminatory attitudes. There is some preliminary evidence that the training might work best for those people who are earlier in their career, so 0 to 10 years experience, people that are straight or a woman, or that are connected to LGBT people, and that might be over 35 years old. But that's preliminary evidence, and it wouldn't be able to be tested in the same way that the other things were. What I thought was one of the most interesting and useful findings from this is the fact that participants told us that they felt after taking the module that they were more confident to be able to support LGBTQ plus young people. So they not only felt we were able to test those things, but they felt more confident. And when we look at other studies in relation to people's professionals' confidence in working with this group, they often say, I'm anxious, I don't really know what to say, I don't know what the issues are, I feel worried that I'm going to offend or upset somebody. So the very fact that the module made people, professionals, feel more confident about supporting LGBT young people is a good thing, because they felt more able to undertake the tasks they needed to do and understood. We tested their knowledge as well as their attitudes. Okay, next slide, please. So there are some good practice examples, and I'm going to talk about this and then some of the outputs before we move on to taking people's questions. So thinking here about what the good practice examples are specifically is in relation to social workers that proactively support and affirm LGBT young people's identity. So that means not just engaging and supporting or other things like that, or a tolerant sort of environment. So we talk about the British values of tolerance and a whole range of other things. But in relation to this, young people were telling us that when social workers proactively engaged with their identities, they found that really welcoming and moving, particularly around things like, we had one young person who said to us that they had a social worker that helped them engage with their local pride event and other things like that. And they found that really helpful. And what's important about this for us to think about is there's been some work by Sue Westwood at York about the fact that we should be moving from tolerance to supporting, even up to the point of celebrating. So the idea that a young person is LGBT, that part of their identity should be celebrated in the same way that we celebrate other parts of identity, as opposed to seeing it only as something that's a challenge or something that needs to be worked with as a further difficulty for that young person. And young people were telling us that they wanted to see social workers and other professionals positively engaging with this. Young people told us that when professionals didn't assume that they were heterosexual or from a binary gender identity presentation, that was important for them. So that's the idea about presenting and asking about pronouns and asking young people how they identify, as opposed to assuming based upon other things that you're factoring. And that means asking the question, asking young people to identify asking people to tell us how they identify and engaging. And I come back to here my sort of core social work ideals around working with people at the center of what we do and thinking about Rogerian principles of unconditional positive regard. The idea that asking the young person who they are and how they'd like to be referred to. Young people also told us that we as professionals and social workers need to understand that coming out is an ongoing and fluid process, which means that they were worried that there were times that their identities might be set in stone by a professional and that they weren't going to be able to, for example, describe a more fluid, whether it's a binary, non-binary presentation, or indeed that they were exploring things, which is something that adolescents and young people do. And we're aware of the fact that that's a normal part of being a young person. And the young people themselves were aware of that. And they were sort of anxious about the fact that if they talked about these things with a social worker, that it somehow would be locked in and that they were going to be unable to explore those things. So talking to young people about the fact that there is an exploration that might be suitable for them and finding out how they feel about it, because some young people did not describe this as an exploratory phase or something that they were working through. They were very clear about their identities. So again, coming back to the idea that engaging with the person at the center of our engagement with them and listening to them. Young people told us LGBT inclusive signals and cues were really important to them. So this is the thing that I was mentioning earlier around rainbow lanyards and pronouns or posters, a whole range of things, even to the point where a social worker who mentioned that they had a favorite drag queen, the young person grabbed onto that single statement as an indication that that social worker was gay affirming, LGBT affirming, and that they used that. And they said, well, after they said that, I felt then confident about telling them that I was LGBTQ plus, and that so they're looking, and these are very, very tiny things sometimes that social workers were saying that for the young people were really important about identifying that that the social worker was not going to be discriminatory. And we're aware of the fact from other research studies that service users use a process of identifying whether the service and the professional is going to be discriminatory or non-discriminatory, and they will be using cues that the professional is providing. So that means that we have to be proactive in engaging with this as social workers. So we need to be asking the questions, we need to be putting out there that we are gay affirming, rather than waiting for the LGBT young person to come out and then be affirming, because that's sort of putting the cart before the horse, or expecting the young person to out themselves when they aren't aware, they can't be sure that the circumstance is going to be supportive. And this comes up against our sense of anti-oppressive practice, which suggests sometimes that as social workers, we are by nature and trained to be open, and that's not enough in this space. And we want to be really clear about that. The young people are telling us that they need more proactive signals. And when they have those, they feel really confident, much more supportive. And they also know where to go for help if things aren't going well in the rest of their experience. They also wanted and found it incredibly moving when social workers and other professionals visibly challenged homo, bi, and transphobic bullying and discrimination. So whether that was in relation to them or in relation to other people, they also stored up those stories as things to bring out and people to go to for support when things were challenging. The last thing that I want to point out here is the fact that LGBT young people found it really helpful when they were connected with resources, both local and national, so that they could know where to go to. Because whilst we think that young people are really great on the internet and know where to go and where to find, they also are looking for support in relation to this. And so that means that we as social workers need to be thinking about how we can connect LGBT young people to these resources. And there's a range of those, and we're getting better at them all the time across the UK that we should be able to be drawing on, connecting young people to. Okay, next slide, please. So some of the recommendations that we've come out of in relation, so if we think about these three studies that were quite different and provided a range of of knowledge that we hadn't had access to before. So we're talking about mandatory training for all social workers and people that work in social care around LGBT knowledge. So whatever sort of factor that would relation to where they come from, we're recommending that that training is easily accessible and it's low cost and effective, because we're aware of the fact that local authorities are cash strapped and this is a challenging circumstance. But if we look at two factors here, the low knowledge of social workers and young people that are telling us when they have somebody who positively affirms their experience, that's important. We suggest that that should include both ongoing coaching and reflective supervision, because we're aware of the fact that the context for training outside of training is really important to embed that into people's practice. We suggest targeted and nuanced policies that reduce discrimination, that specifically identify and talk about LGBT people in social care and their particular and individualized needs. So we need to avoid the idea that we talk about EDI training in relation to this. That's important, but each one of these groups have different experiences, and we would be arguing, and there is evidence to support, that this group has particular challenges that we actually don't understand very well, and we're not doing as much as we could in order to improve and support. To improve placement stability, and when we point to the more placement moves and the longer duration in care, we would identify that there is not as much placement stability as there should be. We suggest assessing the attitudes and competence of professionals and foster carers to support LGBT young people, and thinking about how we should be doing that and what we should be doing when we come across professionals.
I don't know if anyone else has lost.
Sorry about that. That's me.
Oh yeah, you're back. Great.
You're a star. So the specific point here about the contribution is in relation to the fact that this group of young people are often not identified. So we know that there's we know that there's young people who contribute to the development of services, but they're often not representative LGBT young people, and we need to be thinking about that specifically. We're recommending longitudinal studies, so that's looking at people's experiences and how they change over time and how their care experiences relate to their later experiences, as well as more exploratory research on intersectionality and their mental health help-seeking behaviors. And I think we've just got one more slide about outputs, and then we should be ready to move on to the questions. So when we look here, this will just talk about where you can find us and what the project team included, as well as where you can find the rest of the information from the study. There's a series of papers as well as a practice briefing that you can download. The practice briefing is something that you can be using in training, as well as the animated video and all of the project reports, as well as the journal articles. And I'm very happy to open it up for questions, which I think Rebecca is going to be handing over to us one by one. Is that right?
Yes, that's right. Before I do that, I just want to say an enormous thank you. Just such an excellent presentation, and also on a personal note, this is exactly the kind of research I wish my social workers had had access to as a LGBT young person in care, when I'd never met anyone else who identified as LGBT, or actually, after reflecting on your presentation, I think I should say had never knowingly met, because the conditions just were not there to safely disclose. And so, you know, some of your points about how to create an affirming and safe space that is truly intersectional are just so incredibly valuable, as were the reflections on moving from a place of tolerance to celebration. So huge thank you. Just to let you know, if you have any further questions, please get in touch with the research project team, or you can email england@baswa.co.uk. Just huge thank you to our incredibly powerful speakers. Again, I think that word is really overused, but in this context, it is 100% meant. And enjoy the rest of your day, everybody. Thank you so much.
Thanks very much for having us.
Thank you for everything, Rebecca and Beth. Thank you for organising.
Yes, thank you.